and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, ear, nose and throat disorders, particularly infections, are extremely common among children. And to discuss it elaborately, we have with us in studio Dr. Prakritish Bora, Pediatrician from Excel Care Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. So thank you so much, Dr. Prakritish Bora, for coming to Good Life, the health show. So ear, nose and throat are common infections which is seen commonly in children. So let's start with it. And as the season and as the climate is also changing, so these are the things which has to be more concerned about the parents. So what would you like to start with?
Yes, as you said, ear, nose, mouth, these are the three areas where children get infected very easily. So, as we are discussing about common ENT infections or ENT problems rather.
Right.
So, I would like to start with something which is very, very commonly seen, something called common cold.
Common cold.
So, in the medical college days, I remember reading in my textbook, common cold is something which is common and does not require any treatment.
Okay.
And there was a phrase which said, if you do not, if you treat common cold, then it heals in 7 days, and if you do not treat it, then it heals in 1 week.
Is it? Oh, okay.
So basically, there is no role of treatment in this kind of illness.
Okay.
So common cold is basically some of the viruses, almost more than 150 viruses, around 200 viruses, cause common cold in children. Okay. And the commonest age group being 9 months to 3 years mostly, but to some extent about 5 years. So
Okay.
it's basically a disease which affects children who are below 5 years of age. So as we all know, common cold will give you some amount of fever, and it is mostly runny nose and stuffy nose, blocked nose, and to some extent a little bit of coughing.
Okay.
So now that we have COVID around with us, so that is one major difference with COVID with other.
Like how
common
to
cold.
differentiate, like is it a common
because
cold?
Because it's common cold, you have more of nasal symptoms,
Okay.
sneezing, blocked nose, runny nose, all those will be much more aggravated in common cold, whereas COVID you don't come across common, runny nose and all these nasal symptoms so much.
Okay.
So it is more to do with throat and then your lungs
Okay.
in COVID. So that is one, I think, major difference. So
Major
if your
difference.
child, now with COVID times, if a child has fever and more of nasal symptoms, then it is unlikely to be COVID. So as I said, it normally heals in 3 to 5 days, and normally the child will not be so unwell, and the aches and pains in the body is less severe to compared to COVID.
Okay.
And the child becomes irritable because of stuffy nose, blocked nose. He finds it difficult to breathe. So because of all this, common cold makes the child irritable. And
Yeah, normal activities will be less.
Come down. So how do you manage? So the old age home treatment is actually good enough for a child.
Okay.
But if the fever rises really high, say 102 or more, then one could use something like paracetamol syrup, the commonly available T98 crocin. This kind of syrup can help to bring the temperature down. But for mild temperature, I would suggest not to use any medication.
Okay.
Rather, give the child lukewarm bath or sponge. But one should not use cold water.
Cold water. Okay. Normal water.
Warm water. So
Warm
many a
water.
times what we do is put forehead
Yes.
patches.
Yes.
So they are actually of no use.
That's no use. Okay.
Sometimes we do do cooling of the head, but in house, I mean in the house, one could actually sponge the entire body with lukewarm water,
Okay.
which will tepid water, which will slowly bring the
If the
temperature
temperature is high.
down.
Okay.
Yes. If it is high but not to the tune of 102 or more,
Okay.
then one could start using sponging. If it is 102 or more, then one could use paracetamol syrup. And the important thing to remember here is to avoid aspirin.
Aspirin. Okay.
Acetyl salicylic acid, the medical term. So because in children, there are some children after use of aspirin, we have seen that they undergo a syndrome called Rice syndrome, where the liver gets involved, you get jaundice, and it's a serious disorder where the liver might fail. So to avoid Rice syndrome, one should not use aspirin in common cold.
Okay, aspirin call. Okay, doctor, we have a caller, so let's take the call and then we'll proceed with the conversation. Hello.
Hello.
Apuna prashna to koribo.
তাৰমানে এতিয়া মানে কৰোণাৰ কাৰণেতো আমি বহুত মানে নিজকে ল'ৰা ছোৱালীখিনি ছেভ কৰি ৰাখিব লগা হৈছে। তাৰমানে এতিয়া ঠাণ্ডা দিন আহিলে মোৰ ল'ৰাটোৱে মানে কল বা এনেকুৱা ধৰণৰ খোৱা বস্তুবোৰ বেছি ভাল পায়। ঠাণ্ডা দিনত তাৰমানে এইটো এতিয়া চৰ্দি বা কাহ হ'লে এতিয়া কল জাতীয় মানে এইটো খোৱাটো দিব পাৰিম নে নোৱাৰিম মানে সেইটো সুধিব।
ভাল প্ৰশ্ন সুধিছে তেওঁ। এতিয়া আমাৰ এটা কমন বিলিফ আছে বা বিশ্বাস আছে যে চৰ্দি হ'লে আমি কল বা ফল মূল খাব নালাগে, কিন্তু সেইটো আচলতে কমন কল যোনটো বেমাৰ আমি ডিছকাছ কৰি আছোঁ এতিয়া সেইটো বেমাৰৰ ক্ষেত্ৰত এইটো প্ৰযোজ্য নহয়। কাৰণ কমন কলটো হৈছে এটা ভাইৰেল ইনফেকশ্যন আৰু সাধাৰণতে ভাইৰেল ইনফেকশ্যনবিলাক এজনৰ পৰা আন এজনলৈ সোঁচৰে। গতিকে আমি শিশুৰ ক্ষেত্ৰত দেখা পাওঁ যে যোনবিলাক শিশু স্কুললৈ যায়, ডে কেয়াৰ চেণ্টাৰত যায়, ক্ৰেছত থাকে, তেতিয়া অন্য এটা শিশুৰ পৰা সেইটো সাধাৰণতে তেওঁলোকলৈ আহে বা ডাঙৰ মানুহৰ পৰা আহে, কেতিয়াবা ক্ৰাউডেড এৰিয়াবিলাকত গ'লে আহে, হাত দুখন চাফা নহ'লে আহে। গতিকে এতিয়া ক'ভিডৰ সময়ত আমি বহুত কথা শিকিছোঁ যে হাত চাফা থাকিব লাগে, দূৰত্ব থাকিব লাগে, এজন ওচৰলৈ যাব নালাগে। চ' সেই সকলোবিলাক কথাই আচলতে কমন কল্ডৰ কাৰণেও প্ৰযোজ্য। গতিকে কমন কল্ডত আপুনি ফল মূল এভইড কৰিব নালাগে। ইনফেক্ট আপুনি ফল মূল খাবই লাগে, কাৰণ ফল মূল খালে আমাৰ যোনটো ইমিউনিটি সেইটো বেছি ভাল থাকিব আৰু ইমিউনিটি ভাল থাকিলে যোনবিলাক ভাইৰেল ইনফেকশ্যন সেইবিলাক কমকৈ হয়। এতিয়া বেছিভাগ ভাইৰেল বেমাৰৰ আমাৰ চিকিৎসা নাথাকে, গতিকে ইমিউনিটিটো বঢ়াই ৰখাই আমাৰ হৈছে প্ৰথম কাম। গতিকে ইমিউনিটি বঢ়াই ৰাখিবৰ কাৰণে ভালকৈ শাক পাচলি, ফল মূল, মাছ, মাংস, ডিম এইবিলাক খোৱাটো, ফিজিকেল পৰিশ্ৰম ৰখাটো যাতে আমাৰ শৰীৰটো সুস্থ হৈ থাকে। গতিকে এইখিনি আচলতে কৰিব লাগে। কেতিয়াবা কিছুমান ল'ৰা ছোৱালীক আমি ফল মূল বাধা কৰোঁ, কিন্তু সেইটো সাধাৰণতে যোনবিলাক এলাৰ্জিক ৰাইনাইটিছ মানে চৰ্দি কাহ কিছুমানৰ হয় এলাৰ্জিৰ পৰা, তেতিয়া কিছুমান শিশুৰ ক্ষেত্ৰত দেখা যায় যে ফল মূলৰ পৰা সিহঁতৰ এলাৰ্জি হয় আৰু তেতিয়াহে সেই স্পেচিফিক ল'ৰা ছোৱালীক আমি মানা কৰোঁ, কিন্তু সেইটো সকলোৰ কাৰণে প্ৰযোজ্য নহয়।
All right, thank you so much for calling, and I'm sure you must be benefited with the answer which the doctor gave just now. All right, doctor, coming back to the discussion we were talking about, like what things has to be given if the temperature is high, and if it
we were
is
basically discussing about the treatment part. So other home remedies like to reduce the stuffy nose, to reduce coughing, one could use home remedies like tea with ginger.
Okay.
Or with honey, or you can even use lukewarm water with ginger and honey.
The normal tea which the adults are having, we can use those tea?
But without milk.
Without
milk. It should be without milk. And then one can also have tulsi tea or tulsi with lukewarm water. And steam inhalation is very, very good because it reduces your stuffiness in the nose. And one could also use saline nasal drop, which is commonly very easily available now, or you can make it home also in a bowl of water, adding some pinch of salt. You can make it at home also.
Okay.
So nasal drop, steam inhalation, and home remedies like tulsi, honey, ginger, they give you basically they are all they relieve your symptoms. So even medical drugs that we give, they also reduce symptoms only.
So it's very helpful actually, home remedies.
It cannot cure the disease. As I said, if you do not treat, it heals in 1 week. If you treat, it heals in 7 days. So it's the same thing.
It's the same thing. Okay.
And
doctor, we have another caller waiting, so let's take the call first. Hello.
Hello.
Apna prashna to koribo.
হয়, মই ছয়গাঁৱৰ পৰা কৈছিলোঁ। মোৰ আজি 6 বছৰীয়া ল'ৰা এজন আছে, মানে তাৰ গধূলি হ'লে চৰ্দি লাগে, ৰাতি মানে ফেনৰ তলত থাকিলে চৰ্দি লাগে। মানে মই ছাৰক সুধিব বিচাৰিলোঁ কি কাৰণে হয়, বা এই বতৰটো ধৰক এতিয়া সলনি হৈ আছে, এনে কেনেকুৱা কি খোৱালে ভাল হয় বাচ্চাক, বা এই প্ৰব্লেমটো তাৰ কেনেকৈ নোহোৱা কৰিব পাৰি, আৰু ছাৰৰ পৰা অলপ দিহা পৰামৰ্শ বিচাৰিছিলোঁ।
আপোনাৰ পৰিয়ালত আপোনাৰ ফালে বা দেউতাকৰ ফালে কিবা এলাৰ্জি বেমাৰ আছে নেকি বাৰু, যেনেকৈ চাইনাছ?
হয়, মোৰ আছে এলাৰ্জি আছে। দেউতাকৰ নাই।
ঠিক আছে, ধন্যবাদ। চাওক, আপোনাৰ ল'ৰাটোৰ বোধহয় এলাৰ্জিক ৰাইনাইটিছ বা এলাৰ্জিক এয়াৰৱে ডিজিজ আছে। এইটো মানে বুজায় যে পৰিয়ালত যেতিয়া এজন মাক দেউতাকৰ এলাৰ্জি থাকে, যিকোনো ধৰণৰ এলাৰ্জি, এইটো ছালৰ এলাৰ্জি হ'ব পাৰে, বা সেইটো চকুৰ এলাৰ্জি হ'ব পাৰে, সেইটো চাইনাছৰ প্ৰব্লেম হ'ব পাৰে, সেইটো কফৰ প্ৰব্লেম হ'ব পাৰে, বা এজমা থাকিব পাৰে। চ' তেনেকুৱা ধৰণৰ যদি মাক দেউতাকৰ বেমাৰ থাকে, তেতিয়া সেইটো শিশুলৈ আহে। আৰু এনেকুৱা ধৰণৰ ল'ৰা ছোৱালী কি হ'ব, এলাৰ্জিৰ পৰা, মানে এলাৰ্জিটো বিভিন্ন বস্তুৰ পৰা হয়, যেনেকৈ ধূলিৰ পৰা হ'ব পাৰে, ধোঁৱাৰ পৰা হ'ব পাৰে, ঠাণ্ডাৰ পৰা হ'ব পাৰে, ককৰোচৰ পৰা হ'ব পাৰে, জীৱ জন্তুৰ পৰা হ'ব পাৰে, গছ গছনিৰ পৰা হ'ব পাৰে, পলেন্স বুলি আমি ফুলৰ যোনবিলাক পলেন্স। চ' বিভিন্ন বস্তুৰ পৰা হয়। এতিয়া সেইটো এটা সাধাৰণতে এইটো মাল্টিফেক্টৰিয়েল হয়, বহুত বস্তুৰ পৰা হয়, গতিকে এটা বস্তুৰ পৰা হৈছে বুলি ক'বলৈ টান হয়। আনকি বতৰ বদলোতে হ'ব, যেনেকৈ এতিয়া বতৰটো বদলি আছে আমাৰ, এনেকুৱা সময়ত হ'ব পাৰে। গতিকে এই বস্তুটো ইনফেকশ্যনৰ পৰা নহয়। গতিকে ইয়াত আপোনাৰ কথা হ'ল যে যোনবিলাক বস্তুৰ পৰা সাধাৰণতে হয় সেই বস্তুবিলাক আমি পৰাপক্ষত এৰি চলিব লাগিব। আৰু তাৰ ভিতৰত কমনলি যোনকেইটাৰ পৰা হয়, যেনেকৈ ঠাণ্ডাৰ পৰা বাচি ৰাখিব লাগিব, ঠাণ্ডা বস্তু খাব নালাগিব, কুহুমীয়া গৰম পানী খাব, কুহুমীয়া গৰম পানী গা ধুব। তাৰপৰা ধোঁৱা জাতীয় বস্তু ঘৰত নিদিব, ধূপ ধূনা চাকি তাকি এইবিলাক। আৰু ধূলি, চব ধৰণৰ ধূলিৰ পৰা যাতে বাচি থাকে এইটো চাব। ঘৰত কম বস্তু ৰাখিব, যোনবিলাক বস্তু ৰ'দাব পাৰিব সপ্তাহত এবাৰকৈ ৰ'দাই পেলাই বাহিৰত চাফা কৰি আনিব। আৰু ঘৰ চৰ যেতিয়া চাফা হয় বা ঝাৰু চাৰু মাৰে তেতিয়া যাতে সি ওচৰত নাথাকে। গতিকে এইখিনি কৰিলে বহুতৰ যথেষ্ট পৰিমাণে কাহ চৰ্দিটো কমি যায়। কিন্তু যাৰ তাৰপিছতো নকমে তেওঁলোকক আমি কিছুমান প্ৰিভেনশ্যনৰ কাৰণে মেডিচিন দিয়া যায়। কিন্তু তেনেকুৱা ধৰণৰ মেডিচিন সাধাৰণতে দীঘলীয়া যিহেতু চলে, গতিকে ডাক্তৰৰ পৰামৰ্শ নোলোৱাকৈ এনেকুৱা মেডিচিন টেলিভিশ্যনৰ দ্বাৰা দিয়াটো অলপমান অসুবিধা হ'ব।
Absolutely. So these are the things which a proper medication is needed, but after the proper checkup of the child, what exactly is the problem, and then only things can be prescribed at the point. Okay, thank you so much for calling. All right, doctor, coming back, home remedies are very much effective for the children, and if it is used in a proper way. Yeah. So what do you want to add more?
See, now there are some of the children from common cold, although it is a mild disorder, may get into complications. Complications like they might get ear infection.
Okay.
They might get throat infection, or even sometimes, very rarely, pneumonia also.
Okay.
So those are the areas where the child will become sick. He'll have very high spiking fever. He'll refuse to eat. He'll become very fretful. So if all this happens, then one should consult a doctor.
Okay.
And there is a vaccine also now for influenza. So many people think, I just want to clarify some doubts here, because I see a lot of parents, they come to me and they say that if I take flu injection, all my common colds will go off.
Okay.
So it is not true. Flu is a variant of common cold. It's a serious form of common cold.
Common cold.
So flu is something like COVID, where the chances of getting complications are more. It's a viral infection which will manifest like flu, cold, fever, body ache, all these symptoms will be there.
Okay.
But then in flu, the chances of getting a pneumonia is higher.
Okay.
So that is the reason in high risk children who have asthma, who have allergy. So in children who are in a high risk situation, we advise the flu injection, which has to be taken every year.
Okay. So sometimes we also see that some children, they suffer a big major temperature like 104 or 105. So is that the time that one should immediately consult a doctor? Because if it rises at night time, they will give the medicine and it will be down. But after that, next day, do they should consult a doctor, or do they have to take a necessary?
Certain things you have to remember, because on the first 1 or 2 days, the fever might be high. That doesn't mean you have something very serious. So if you give paracetamol and the fever comes down and child is otherwise normal, playing and all, so then you don't need to worry.
Okay.
In the fever-free period, if the child is healthy, active, playful, eating well, then it's okay.
Okay.
But if the child is very, very looking toxic and sick, not eating at all, his urine output has gone down, he is fretful, irritable, and the fever spikes, are coming very frequently.
Very frequently.
So those are the times when you might consult a doctor. So it is basically the discretion of the parents, because they remain with the child all the time. So they know how their children normally behave, child normally behaves. So if the behavior is looking abnormal, then one should take an early consultation. Otherwise, one should wait at least for 3 days. If the fever has not gone down after 3 days also, then one could, yes.
Okay. And how long they should keep a check on the temperatures, like if a medicine has been given, so the temperature comes down?
It should not be like in the hospital where we check every 2 hours or 4 hours. So one should only check the temperature when the child is warm.
Okay.
You find the child warm and he's not looking happy, then you check the temperature.
Okay. All right, doctor, we'll proceed again with the conversation, but right now we'll have to slip into a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Prakritish Bora. So we'll straight away move to him. Doctor, earlier to the break, we were talking about common colds and all. So now let's talk about tonsillitis, which is also seen in children. So what would you like to put light on?
Along with tonsils, I would like to include the adenoids also.
Adenoids.
So basically, what tonsil is, it's a lymphoid organ. Okay. There is lymphatics in our body. Lymphatic is something like blood, but it's like a clear fluid which circulates in our body, and they drain into the lymphoid organs.
Okay.
So lymphoid organs are tonsils, adenoids. Then there are lymph glands also inside our body. So tonsils are located inside our mouth on the sides, and adenoids are located just behind the nose.
Okay.
On the roof of the pharynx. So you cannot normally see the adenoids. Now, many children who are specifically born to allergic parents or who have allergy, they tend to have increased size of the tonsils and the adenoids.
Okay.
So many times we mistake that if the tonsils are big, then they should be removed or they have an infection. So tonsil is the organ. When you have infection there, it's called tonsillitis.
Tonsillitis. Okay.
Adenoid is the gland. When you have infection of the adenoids, then you have adenoitis.
Okay.
So one has to understand the difference. So if you have tonsils, enlarged tonsils, that does not mean you have infections also.
Okay.
But allergic children or children who get recurrent infections of the tonsils and adenoids, they tend to have larger adenoids and tonsils.
Okay.
And we often see that adenoids create more problems than the tonsils. So there's a thing called adenoid phases. If you have severe kind of adenoids, if they are very, very big, then what happens, our palate and the adenoids, because adenoids are located behind the nose.
Behind the nose.
So they block the airway completely.
Okay.
So this kind of children will continuously breathe from their mouth. They become mouth breathers. And what happens, their breath will stink, number one. Number two, their teeth will come out, but they'll have buck teeth.
Okay.
Because they're breathing from their mouth all the time. And they have a very unintelligent look on the face. The
that
child
can
will
be
look very,
okay.
very dull. So this is something called adenoid phases. So if a child has adenoid phases, if his growth is stunted, if he's having to take antibiotics repeatedly, so that is the time when we have to remove the adenoids. So one has to see an ENT surgeon for removal of the adenoids.
Okay, doctor, we have a caller waiting. Let's take the call first. Hello.
Hello.
Hello. আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
মই কাহিলিপাৰৰ পৰা কৈ আছো। একচুয়ালি আমাৰ ছোৱালীজনীৰ বয়স 5 বছৰ হৈছে। তাই আজি কিছুদিনৰ পৰা পেটটো বিষাই বুলি কয়, মানে যেতিয়া ভাত খায় বা কিবা যিকোনো খোৱা বস্তু খোৱাৰ পিছতে কয় পেটটো বিষাই বুলি। তো মই ভাবিছো যে পেলু হ'ব পাৰে। তো মাজতে আজি 3-4 মাহ মান আগতে পেলুৰ দৰৱ খাইছিলে, কিন্তু এতিয়া আকৌ খাব পাৰিম নে কি কাৰণ হৈছে ধৰিব পৰা নাই। কিন্তু তাই খুব ঘামে আৰু মানে স্কিনটো অকমান ড্ৰাই টাইপ হৈ গৈছেগে।
পেটৰ মাজভাগত বিষাই নহয় জানো?
হয়, মাজত।
তাই পায়খানা সদায় কৰে নে বাৰু?
পায়খানা ৰেগুলাৰ কৰে।
এনে সাধাৰণতে কেনেকুৱা হয় পায়খানাটো?
এনেটো নৰ্মেলি আছিলে, আজি কিছুদিনৰ পৰা অকমান তাৰমানে বিজলুৱা টাইপৰ নিচিনা হৈছে পায়খানাটো।
আপুনি পেলু দৰৱ কেতিয়া দিয়া বুলি ক'লে?
3 মাহ মান হ'ল, 3 মাহ মান আগতে খুৱাইছিলোঁ।
সাধাৰণতে যদি পায়খানাত পেলু দেখা যোৱা নাই, পেলু দৰৱ আমি 6 মাহৰ আগত আচলতে ৰিপিট কৰিব নালাগে। গতিকে মই নাভাবোঁ যে এইটো পেলু হৈছে, কিন্তু যদি খুবকৈ মিউকাছ গৈ আছে, মানে বিজলুৱা গৈছে, তেতিয়া কিছুমান ইনফেকশ্যনত তেনেকুৱা হয় যে পেট বিষাব, পায়খানাটো বদহজমী নিচিনা পায়খানা হ'ব। সেইটো জিআৰ দিয়াটো কমনলি হয়। গতিকে জিআৰ দিয়াৰ কাৰণে আমি আচলতে মেট্ৰনিডাজল বুলি এটা দৰৱ দিওঁ, আৰু আজিকালি নিটাজক্সামাইড বা এনেকুৱা ধৰণৰ অন্য মেডিচিনো আছে। গতিকে তেনেকুৱা মেডিচিনৰ প্ৰয়োজন হ'ব পাৰে, আৰু সেইটো কাৰণে অৱশ্যে আপুনি পায়খানাটো এবাৰ টেষ্ট কৰাটো ভাল হ'ব। আপুনি পায়খানাৰ এটা ৰুটিন টেষ্ট এলং উইথ অ'কাল ব্লাড, মানে ষ্টুল আৰি এণ্ড OB বুলি ক'ব পাৰে, এই টেষ্টটো কৰিলে কথাটো ক্লিয়াৰ হৈ যাব। যদি তাত এনেকুৱা ধৰণৰ কথা একো নাই, ইনফেকশ্যন নাই বা ইনফেষ্টেশ্যন নাই, তেতিয়া মই ভাবোঁ যে আপুনি তাইক সদায় ৰেগুলাৰ পায়খানাৰ অভ্যাসটো আনিব লাগিব। কিছুমান ল'ৰা ছোৱালী কি হয়, পায়খানা কৰিলেও ভালকৈ ক্লিয়াৰ নকৰে আৰু সময়ত নকৰে। গতিকে পায়খানা কৰাটো ৰাতিপুৱা কৰাটো ভাল এটা নিৰ্দিষ্ট সময়ত, আৰু ল'ৰা ছোৱালীবিলাক
কৰি পেলাই আকৌ মাজতে ৰাতিপুৱা কৰি পেলাই আকৌ গধূলিলে আকৌ মানে পায়খানা লগা বুলি কয়, হয়তো ক্লিয়াৰ নহয়, তেনেকুৱা হ'ব পাৰে।
তো ক্লিয়াৰ নহ'লেও পুৰণা পায়খানা থাকিলে এইটো আমাৰ কোলনটো লোডেড হৈ যায় বা তাতে খুব বেছি গেছ হয় তেতিয়াও পেট বিষায় চ' সেইটো এটা খুব কমন ৰিজন আজিকালি গতিকে আপুনি কি কৰিব লাগিব সদায় ৰাতিপুৱা সময়ত নিৰ্দিষ্ট সময় এটাত পায়খানাত বহাব আৰু ভালকৈ অলপ সময় এটলিষ্ট 15-20 মিনিট আধা ঘণ্টা ভালকৈ বহিবলৈ দিব খৰখেদা কৰিবলৈ নিদিব আৰু যিমান পাৰে শাক পাচলি ফল মূল আৰু পানী সৰহ হ'ব লাগে খোৱাত
All right, thank you so much for calling. So, doctor, we were talking about the removal. So, is it any problem to remove?
See, there are a lot of children who will have adenoids, but that does not mean you will get it removed.
Okay.
So, one should be absolutely sure about the indication. As I said, if someone has adenoids, someone has great failure, someone is having to take antibiotics repeatedly in the year. So, those are the children we normally advise surgery. And if someone has severe snoring or sleep apnea, I mean, apnea basically means if you hold your breath because of the blockage, if the child holds his breath for a very long time, where his heart rate will come down and he'll become blue. So if there is apnea kind of situation, or if there is severe snoring and he finds it very difficult to sleep at night, so there are certain clinical situations where we advise removal of the adenoids. See, adenoid is an important organ. It basically purifies the air when we are inhaling. It makes the bacteria, virus, it trap those organisms. So it is important for our body.
That's what, if the removal it's needed, depends on the case and what the symptoms or the
severity of the symptoms.
Oh, doctor, we have another caller waiting. Hello.
Hello, মোৰ বেবি বয় এটা আছে তাৰ বয়স হৈছে 5 মাহ মই জানিব বিচাৰিছিলো তাক কিমান মানে ফ্ৰিকুৱেন্টলি খোৱা পানীটো দিব লাগে তাৰ 5 মাহ হৈ গ'ল আচলতে বিস্তাৰি
চাওক তেনেকুৱাটো ফিক্সড এমাউণ্ট নাথাকে পানীৰ কিন্তু আপুনি যেতিয়া গোটা আহাৰ দিব এতিয়া 4-6 মাহত 4 বাৰমান আপুনি গোটা আহাৰ দিব পাৰে তাৰ ভিতৰত আপুনি ধৰক এবাৰ খিচিৰি ভাতটো দিব পাৰে দিনৰ ভাগত দুবাৰ আপুনি জলপান দিব পাৰে জলপানত চুজি ডালিয়া ওটছ তাৰপিছত পিঠাগুড়ি এনেকুৱা ধৰণৰ জলপানবিলাক আৰু ফল মূল কিবা এটা দিব সদায় পকা ফল মূল যেনেকৈ কল অমিতা তাৰপিছত এপলটো দিব পাৰে অলপমান এপলটো সিজাই দিব পাৰে কোমল কৰিবৰ কাৰণে তো এনেকুৱা ধৰণৰ বস্তুবিলাক যেতিয়া দিয়ে তাৰপিছত আমি যেনেকৈ পানী খাওঁ 1 চামুচ পানী খুৱাব পাৰে আৰু যিহেতু গৰমৰ বতৰ এতিয়া বতৰটো চাই পেলাই আপুনি মাজে মাজে পানী দি চাব পাৰে সি যদি খাইছে ভাল কথা নাখালে জোৰ জবৰদস্তি নকৰিব এইটো বয়সত সিহঁতৰ ডিমাণ্ড বা সিহঁতৰ ৰিকুৱাৰমেণ্টটো বাচ্চাই নিজে বুজি পায় শিশুৱে নিজে বুজি পায় চ' সেইকাৰণে সিহঁতক মাজে মাজে অফাৰ কৰি চাব যেতিয়া সিহঁতে খাইছে ভাল কথা নাখালেও ইমান জোৰ কৰিব নালাগে
All right, thank you so much for calling. So this is very important actually. We shouldn't force the children to drink water and be back of them to have these things because they will demand themselves maybe when they'll see
basically
things.
Offering more frequently is important. Offer them if they are taking it applies for both food as well as water as well as other drinks. And another thing that once we start giving solid food to the baby, then one should come down on the milk. So many times I see a lot of parents they focus more on the milk and less on the solid food. After 6 months the requirement of milk comes down. So one should focus more on the solid food.
All right, so because we have seen many children they stick to milk and they don't want to come back to those food items or to maybe there may be some problematic of having those solid kind of things and we have seen they make it liquid and they feed it to their children. So these are many problems which has been faced by the parents as well.
See, in the learning process, I mean, the baby, when he comes out of the mother's womb, the baby knows only one thing, sucking and swallowing. So they do not know how to chew. So 6 months is the time when we have to reduce mother's milk.
That's a very crucial time to teach.
That is the period when there is transition from liquid to solid. So it has to be a gradual one. One has to be very gradual in stepping up the solid. I mean the quantity of solid and how solid it is.
Mild to major.
And secondly, because he has to learn to chew, so one should be fed with a spoon or with clean hands. So these are the two ways, and one should not be made to lie down and then feed because lying down you don't know you cannot chew. You'll only swallow it. Then the chances of choking goes up. So the proper way of feeding is that you have to make the child sit on your lap and use your clean hands or a spoon to feed the child. And initial period when the child is learning, he might sometimes vomit, he might choke sometimes, but that should not deter one from making it very. What people do is they
get scared and not
they
try
use the
again.
mixie to make it very liquid and give it to them. Then in this situation, the child will not learn to chew.
Okay, okay. Doctor, we are really short of time. So on last note, what would you like to tell our viewers?
See, the common ENT problems that we have in children are very easily manageable at home, and you should wait for at least a couple of days or 3 days before you see a doctor in case of common cold. But if the child is looking toxic, if you see that the tonsils are red, inflamed, there's a patch on the tonsil, or the discussions that we had about adenoids, in those situations you may see a doctor. So there are a lot of things that we are left behind and we could not discuss today. So maybe in the next time we'll...
Absolutely. We'll try and finish the topic which we have taken today. Thank you so much, Dr. Prakritish Bora, for coming to our show. And with this, we have come to the end of the show. We hope that we were able to answer your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.